We're going to finish this lesson by addressing special challenges faced by both younger and older drivers. Let's look at the younger drivers first. Traffic fatalities are the leading cause of death for females aged 15 to 24 in Missouri, and the second leading cause of death for males in that age range. It used to be the leading cause of death for males in Missouri aged 15 to 24 also. But the reason it's still the leading cause of death for 15 to 24-year-old females is cell phone use. Physical and emotional factors associated with youth, combined with inexperience, make younger drivers far more likely to be in crashes. According to the Safe Road Alliance, about 2 in 5 drivers will have vehicle crashes in their first year of driving. These range from minor one-car collisions, like hitting a road sign, to the most serious possible crashes involving fatalities. Research into the causes of crashes among inexperienced drivers found that these younger drivers were overwhelmingly at fault. This is true even though physical coordination and reaction times are generally better in younger drivers. The Foundation for Highway Safety reports that although 16 to 19-year-olds only account for about 7% of annual miles driven, this age group is involved in 41% of all crashes and almost 30% of all fatalities. Also, the American Society of Pediatrics reports that in addition to the deaths of teen drivers, more than half of the 8 to 17-year-old children who die in car crashes are killed as passengers of drivers younger than 20 years of age. The challenges faced by novice drivers are enormous. Driving involves more than just motor skills and reaction time. Most researchers found the ability to recognize hazards and respond effectively to them was far greater in drivers more experienced. Oddly, studies show that time spent as a passenger watching other drivers didn't add up to actual experience. It didn't improve ability to see hazards. The only thing that worked was time behind the wheel. Younger drivers also face physical challenges, though. Hormonal changes in younger drivers tend to foster risky behavior, including drunk or drugged driving. Less obvious types of risky behavior that lead to crashes are behaviors like not scanning the driving environment thoroughly, driver distractions, or poor judgment on the space required to pass. Now let's examine the challenges faced by aging drivers. It's a fact that older drivers age. Their vision and hearing gets worse, and their reaction times slow. But there is positive news too. In some ways, older drivers are safer than any other age group. According to AAA, older drivers are the most likely age group to wear safety belts, observe speed limits, and avoid drinking and driving. Mature drivers tend to drive less after dark, during rush hours, and they avoid difficult driving situations like busy highways and complex intersections and interchanges. As a recent study by the Rand Corporation found, one of the main reasons mature drivers aren't found to be much riskier drivers is that they change their driving habits to compensate for their diminished competence as drivers, even though their driving skills do decline with age. But changing driving habits can't overcome the effects of time. As one researcher put it, driving relies on complex neurophysiological processes that happen way below conscious awareness or control. These processes become impaired in normal aging and in the accompanying neurological changes, compromising fitness to drive. To put that in simple English, older brains don't work as well as younger brains. This means poor motor skills, often accompanied by weaker muscles and reduced flexibility. These factors make it harder to do things like grip and turn the steering wheel, or press the accelerator or brake pedal. But one of the greatest challenges faced by older drivers is that aging makes it less likely to survive a crash. If you look at these charts, you'll notice that crashes, injuries, and fatalities all decrease in each decade from the 20s to the 60s, with a slight rise in the 70s, and then a large increase in fatalities for drivers over 80. This chart makes it even more clear. Notice the two bars on the right-hand side, showing a 44% higher risk of dying in a crash for drivers under 25, and a 573% increased chance of dying in a crash for drivers 65 and older. With the exception of teen drivers, seniors have the highest crash death rate per mile driven, even though they drive fewer miles than younger people. So how do we minimize the challenges for both of these age groups of drivers? When it comes to younger drivers, studies show hands-on experience is the only way to become a less risky driver. Two tips can help younger drivers get experience in the way they reduce risks while they're learning. The first is having supervision when they drive. As much as a teen driver may not like it, studies show that an experienced driver alongside a new driver decreases risks to levels similar to having an experienced driver behind the wheel. It may be that the experienced driver recognizes hazards where the new driver doesn't, and they alert the younger driver. It might also be that a teen driver who is supervised is less likely to break rules and more focused on the driving task when someone's watching. But the second tip is to recognize that inexperience, sleep deprivation, and a greater willingness to take risks are more common in younger drivers, and find ways to counteract those. But what if supervision from an experienced driver isn't available? If you're a novice driver, try to act like an experienced driver is supervising you. Use the tools like awareness of following distance, keeping a good space cushion, and scanning as if those skills are the experienced driver with you. With an older driver, if there's any doubt they should be driving, a doctor should conduct an evaluation for possible restrictions on driving. These types of restrictions are usually voluntary though, and most state DMVs don't have a method for doctors to order restrictions or revocations of driving privileges. It must be remembered though, that driving for an older person is one way that they can maintain their independence. For an older driver who wants to continue to drive, here are some recommendations from the CDC that will make it safer for you. As much as possible, only drive during daylight and in good weather. Plan your route before you drive. Find the safest route and well-lit streets, intersections, with left turn arrows and easy parking. Leave a large following distance behind the car in front of you. Maintain a moderate rate of speed and avoid unnecessary lane changes. Avoid distractions in your car, such as listening to a loud radio, talking on your cell phone, texting, and eating. Exercise regularly to increase strength and flexibility. Have eyes checked by an eye doctor at least once a year. And ask your doctor or pharmacist to review medicines, both prescription and over-the-counter, to reduce the side effects and interactions. Finally, the CDC urges older drivers to consider potential alternatives to driving, such as riding with a friend or using public transit. That completes this lesson on the first tool of defensive driving, preparation. After a brief question, we'll move on to step 2 in our look at defensive driving, anticipation.